And thanks for joining us as we begin a new week and consider the challenges that lie ahead. To welcome members of the media and those who are watching us online. Today, Orange County Mayor will discuss our positive cases, our numbers here in Orange County, and our budget as it relates to COVID-19 and some difficult decisions clearly that have to be made in the future. Orlando Mayor Buddy Dyer here to discuss what is taking place within the city of Orlando on these same topics. Dr. Raul Pino from the Florida Department of Health in Orange County has information on our testing numbers and timeframes and other important data. We start this press conference with Mayor Demings. Mayor?
All right. Good afternoon to all of you. Thank you for being here and weathering the storm to get in this afternoon. I'm reminded that we are still in the hurricane season. But also, let me just say that I hope all of you had a good 4th of July weekend, and I have to give some accolades to the residents of Orange County because largely as I moved around during the weekend, people were wearing their mask, and so hopefully as a result of the wearing the mask and following the CDC guidelines, we will not have a repeat of what we saw during the days after the Memorial Day weekend. Of course, you all know that we saw significant spikes after that weekend because people just didn't adhere to the guidelines that were being put in place. But I remain optimistic that we are on the upswing. But we just left a budget meeting here within Orange County, a full day's meeting. Literally, it started at 9 a.m. and we concluded about 5 minutes ago. I will report to you that our budget will remain flat overall for the next fiscal year, 2021. However, another casualty of the pandemic will be the planned expansion of the Orange County Convention Center as we knew it. The expansion project will be delayed at the very least. I want our residents to also know that we are eyeing the budget in the most prudent and fiscally responsible manner possible as we move forward. The goals for this week. Each Monday we try to come to you and tell you what we hope to accomplish. The number one goal this week for us remains to stop the spread of the virus through driving adherence to the CDC guidelines. Number two, to continue working with the state to increase testing. Number three, to continue our crisis assistance for families, individuals, and small businesses. We do have a staff member here today who's been working in that environment, should there be any questions related to that. And the fourth goal this week is to work towards safely improving our commerce here in this community. So let me just talk briefly about the numbers. While there's some concern and pause for the numbers, I saw a glimmer of, I think, hope in the numbers, and I'll share that with you. Over the weekend, Florida's total coronavirus cases topped over 200,000. Today, the number of cases in Florida is over 206,000. In Orange County, a total of 14,407 cases were reported today. That's a cumulative number. However, today, within the last 24 hours, 375 cases were reported. Over the last 5 days, we have seen an increase of over 3,500 cases. But when we look at the last 24 hours, that was the lowest number of new cases that had been reported in several days. So I'm encouraged by that. We saw some days over the holiday weekend where we had 1,000+ new cases reported. But within the last 24 hours, 375 cases. So I see that as a trend. Hopefully that's headed in the right direction. Sadly, though, however, we are now up to 61 Orange County residents. I know Dr. Pino from the Florida Department of Health has the most current numbers, and he'll be sharing that with you in just a few moments. We have tested over 157,000 individuals in Orange County, and our positivity rate is now 9.2%. which is about the same as the state of Florida's positivity rate. With the surge in cases, the Business Compliance Working Group, which is a subcommittee of the Economic Recovery Task Force, will be meeting next week. Again, we want to be able to reopen safely, and we are looking to the collective thoughts of those individuals to help provide some advice to us as we move forward with reopening. If the coronavirus cases still appear to be increasing at a high rate, certainly we will have to make some adjustments going forward. In terms of testing, Orange County Health Services will be testing this week at Legacy Middle School. The appointments again have been taken. However, if you want to drive up, walk up, they may be able to fit you in to get you a test. The City of Orlando will have a mobile testing site at the Camping World Stadium. I understand Mayor Dyer, that is starting this Wednesday at the 8th. Health Services is also planning to open a testing site at the Barnett Park next week. You can also get additional information by going to our website at ocfl.net/coronavirus for more information on testing sites. In terms of the crisis assistance, we are moving forward with trying to get funds in the hands of individuals and families as well as small businesses here within Orange County. There have been 13,500 approvals of individual applications so far, which represents nearly $14 million in financial assistance to families here within Orange County. The staff is working diligently to review and approve applications as quickly as possible. And as a reminder, we will reopen the application portal 1 week from today, on Monday, July the 13th. Our Orange Cares business program continues to have its application portal open. That is a continuous process there. About $16 million in grants for small businesses have been processed for approval to date. And so with that, I'm going to turn it over to Mayor Dyer, and then he will be followed by Dr. Pino, and then we'll open it up for any questions that you may have.
Thank you, Mayor Demings. As we begin another week with this pandemic, I want to stress again to our community residents that we must continue to take this virus seriously. It should be alarming. It should be eye-opening to all of us, the manner in which this virus continues to spread. We have to remember that our actions affect others, and by simply wearing a mask, we can make a difference in somebody else's life. With the numbers that we have experienced over the last week, we must remember that our actions can make a difference in the ability to respond to the virus, to reduce overwhelming our hospitals, and to protect our healthcare workers. The virus continues to exist, it continues to spread, but we are Orlando. We stand up for one another, and we mask up for one another because it's the right thing to do. Mayor Demings mentioned that we need to continue to expand our testing opportunities. Each week we're testing on Wednesdays. This week we're at Camping World Stadium from 9 to 1. Right now those appointment slots are filled, but you can still walk up or drive up to Camping World on Wednesday, and we'll announce next week's site and the opening of appointments later this week. Thank you. Dr. Pino.
Good afternoon. This is week 28 of the year, and I will reframe the conversation in weeks because it's the same way that we are following the data so that people understand. As the mayor referenced, Mayor Deming, that is, yesterday we received 2,208 negative results and 374 positive tests. That is a 14.5% positivity rate for yesterday. We also have seen an increase in the recovery rate that was really low last week. Right now it's about 61%, and that's an important number that people would like to have in mind. We also have seen an increase in the number of ER visits for fever, cough, and shortness of breath, as well as an increase in the hospitalization. But syndromically speaking, influenza-like illnesses and COVID-like illnesses are stabilizing. Our positivity rate for the duration of the pandemic is 9.2. I will let you know about the last 14 days because that's the number that I follow the closest. With regard to the sad news of fatality number 60 is a 89-year-old female, Black, non-Hispanic, and we don't know exposure. The person died on the 2nd. And fatality number 61 was 86 years old, male, Hispanic. We don't know the exposure yet, but we know that had significant pre-existing conditions. Also, for your general information, antigen testing is counting since July 1st as a positive case. And since that, there have been 698 positive antigen test results in Florida up to date. So those will starting to be included in our count starting July 1st. With regard to the data, our age increased by 1 year, the median age, and about 52% of our cases in the last 14 days have been between 20 and 40 years old, and continue to be a young pandemic for us. Last week, our week 26, we are in 28, so week 26 so far is the highest that we have in incident rate per 100,000. So that week 26, our rate per 100,000 was 343. Last week, our rate was 271. So there was a reduction in our rate right there. And also part of the hopeful news that the mayor was talking in the data, last week we saw a reduction, a negative growth of 21% when you compare to the prior week. And that coincides exactly with the second week that we have the mask on ordinance in Orange County. And that should not be a coincidence. The median age for the past 14 days for us is 32, as I mentioned. For the state is 36 years old. Also, we have seen a slight reduction on positivity rate from the highest that was in June 30th, and this is a 14-day rolling average. This is the data that we follow here, is analyzed here in Orange County. We follow the 14-day positivity rate in average and a rolling average. So on June 30th, we were at 15.77, and on the 5th, we were at 14.58. So the reduction is not significant, it's very slight, but it's moving in the right direction. For hospitalizations, and we mentioned that they have increased and they normally go behind, like 2 or 3 weeks, the number of increased cases. So total hospitalized COVID today in the morning in Orange County, that doesn't mean that they are all Orange County residents, but it means they are in a hospital in Orange County, 357 individuals. That's an increase of 164 from the last data point that I have in June 28th. And for ICU beds, we have an increase of 35. It went from 37 on June 28th to 72 today in the morning. With that, I know we always have a concern about beds and what is available in the county for our residents. Although we have seen an increase in the number of hospitalizations, the systems are reporting that they are not concerned about the need for a surge yet as a system. It could be that a hospital have more cases than other, and things have to be reshuffled and readjust. But in the county this morning, right now, not this morning, just right now, we have 511 beds available here. Again, that's 511 beds available in our county. We have 499 ventilators available in the county at 11 o'clock in the morning. We have 58 ICU beds available in the county for adults. We have 46 ICU beds available for pediatrics, and we have 13 long-term care facility beds available for our residents. I will pass it to Mayor Demings and answer any question that you may have.
Okay, so I think in the midst of the misery that we talked about, there's some bright points there. And we're managing the virus is essentially what we're saying to you. With that, we do have a couple of our county commissioners here, Commissioner Uribe and Commissioner Gomez-Cordero. So as we go to questions, if you have any questions, ask them, ask them the tough questions and leave the easier ones for us. So in either case, any questions that you all may have, we'll answer at this time.
Hi, Kelsey with West 2 News. This question is for most likely Mayor Demings as well as Dr. Pino. I know you talked a little bit about at the beginning of this press conference about what you saw over the 4th of July weekend. Can you talk a little bit more about that, just from what you've seen? Were people complying? Were there any big groups? Are you worried that we could see a higher surge? Or are you hopeful that people took this seriously? And that's for both of you guys, please.
For me, I drove around the county quite a bit. I saw a much better response during the Independence Day weekend than I did during the Memorial Day weekend in terms of people who were wearing masks and following the CDC guidelines. That was the type of desired response we wanted to see from our community, and I believe that if that continues, then we somewhat control our destiny going forward in terms of stopping the spread of the virus. Dr. Pino?
No, I agree with the mayor. I went around a little bit. I also was embarrassed. Went into Home Depot, forgot my mask in the car, came out to the garden area, and this guy told me, hey, psst, you are talking about the mask for you on. So, but I had it in the car. So yes, I have seen an increase in the use of masks, and also an increase on the display of businesses requiring people wearing masks. So that's an important step. And we can do more, and we should. It works. And the data is telling us that if we mask on, will we see a reduction in the number of cases? We can bring it down to what it was.
Emily with News 13. This question's, again, most likely for Mayor Demings here, but can you comment as to the executive order that just came out from the Florida Department of Education, basically stating that schools must open a brick and mortar location 5 days a week going into the school year next month with certain waivers applicable? Do you think this is okay in terms of safety with COVID-19, and just what are your initial thoughts on that overall?
Those are decisions that really are going to primarily have to rest with the respective school districts throughout the state of Florida. There's probably a way for them to be able to open in a safe manner if they follow the CDC guidelines. They're going to have to be creative to ensure that the areas are sanitized as best as possible. They're going to have to be creative to ensure that there's appropriate distancing between the students. I believe that they have the opportunity to open with I think, a bifurcated type of an educational learning environment where some of it can be virtual, some of it can be in person. So I remain optimistic there for our children to be able to get back to school, to be able to learn. So we're just going to have to work with them to make it as safe as possible. And that requires all of us to work together. That's a month or so away. And if we continue to work together, I'm optimistic that we can lower the numbers and contain the virus to the extent we can, and our children can return to school. So again, I want to leave you with that bit of optimism going forward. The healthcare experts are giving an abundance of guidance to our school districts in order to be able to do it. I have grandchildren within the Orange County Public Schools, and so I don't want them returning to an environment if it's not safe for them to be able to do so. So much like the parents and others out there, I know that everybody remains truly concerned about this. Even the teachers and the staff that works within those schools, they're all very concerned, but there's a way for us to do it, I believe. Okay. Mayor Dyer, you want anything on that? No? All right.
Yeah, this is Rafael from Telemundo. This question is for Dr. Pino in Spanish.
Dr. Pino.
¿Cómo está, doctor Pino?
Muy bien.
La pregunta es, con todo lo que está ocurriendo esta semana y la próxima semana en Disney, con MLS, equipos de NBA viniendo, la reapertura de los parques, ¿cómo se siente usted al respecto? ¿Cree que estamos en capacidad de manejar esta situación?
So the question was, with everything that is happening with Disney and MLS and NBA coming, do I feel confident that this could be done? Mira, hemos estado muy envueltos en conversaciones con la NBA y MLS respecto a los planes y cómo se va a hacer todo. Han diseñado un programa bien serio para proteger a los jugadores y los empleados del que viene. Estamos también en conversaciones con Disney para otras iniciativas de testing en el área, pero pensamos que los planes son seguros. Van a haber casos positivos, entre los jugadores, los van a haber, eso no hay ninguna duda. La cuestión es cuántos, qué tipo de transmisión, se va a transmitir entre equipos o solamente en un grupo pequeño de personas, y esas son las cosas de que estamos alerta. La NBA y todos están dispuestos a parar cualquier torneo en caso de que las cosas no nos vayan de la manera que las hemos diseñado. Una cosa es lo que nosotros diseñamos y otra cosa es lo que pueda pasar en realidad. So the answer to that question was that we have been very in close conversation with both MLS and NBA with regard to the testing strategy that they have in place, or what they have called the bubble, and how often they are going to test players who get to get tested. And the question is now if they are going to have positive people. They are going to have positive people. We are in a pandemic environment. The question is how many and what type of transmission is going to happen there. It's just a small group of people among the closest, or there is transmission between teams, and that will indicate, some kind of different action needed. But they both are willing to, if we suggest so, if the need arises, to take some harder consideration to the tournaments itself, if this were to become an issue. But we are not expecting it. In some cases, they are testing their players twice a day, and some of the initial cases that may have come already acquired from other locations were detected. So the system is working as it was designed. So we are hopeful that it can continue to be the way it is. Thank you.
I have a few for you, Dr. Pino, that were texted in. This first one comes from Nikki Zizaza from WKMG. Dr. Pino, can you confirm if Advent Health is about 1 week away from reaching capacity in Central Florida?
I don't know the question to that. The answer to that, the data that I offered was all beds, includes all systems. It could be that Advent Health in some areas may have more cases than in other areas because they're run across, I believe 7 counties. So I will not know the answer. That's a question for Advent Health.
This next one for you, Dr. Pino, comes from Matthew Petty here with WMFE. He goes, Governor DeSantis wants to make antibody tests more widely available. Are there plans to ramp up antibody testing in Orange County?
There are plans.
Lauren Seabrook here for you, Dr. Pino. Has the county or state seen anyone test positive for COVID-19 for a second time?
I don't know the answer to that. It will have, what we have seen is people testing twice. If she's referring to someone being positive twice, a person that was positive, negative, and then positive, I have not seen that yet. But it doesn't mean that it didn't happen, it just haven't seen it.
Thank you. These last few are for Mayor Demings. Mayor Demings, text in from Naseem Miller from Orlando Sentinel. Why aren't the health systems in Orange County releasing their COVID-19 hospitalizations data? Have you had any conversations with them? And why can't we access this data without having to request it from the Department of Health?
Well, currently they're required to report the data to the Department of Health. And so I think across the county, across the region, across the state, the Department of Health is a keeper of the information. Then some of the data within the respective hospital is proprietary. You know, it's unique to that particular hospital, and they do share the data with me. You know, verbally we have conversations several times a week about it as we endeavor to make decisions on behalf of the residents. I go to Dr. Pino, and he shares with me what he sees in his dashboard on a daily basis.
This one is from Lauren Seabrook. Today, the Miami mayor made an emergency order to shut down restaurants, venues, and gyms again. At what point would you consider doing that here?
I believe that we would consider that in consultation with our health experts if they were able to identify a disproportionate number of restaurants and gyms as outbreak centers or clusters that started an outbreak. So we aren't seeing that at this point.
This is from Steve Moore with WUCF. Mayor, are you confident it's the right decision to reopen Disney World this weekend?
At this point, I'm fairly comfortable with the decision that Disney has made to reopen because of the extent that they have gone through to ensure it's a safe environment. Again, we saw something positive today in terms of the lowering of the positivity rate within the last week and some other things. So we have to take the good news where there's bad news as well, and we have to try to get our economy stimulated, but we don't want to do that at the expense of risking people's safety. So what Disney reviewed with all of us several weeks ago now should be in place, and we'll just have to monitor it going forward.
This next one's from Troy Campbell with WKMG. Mayor Demings, what is your message to people criticizing the decision by major sports leagues to bring hundreds of players and staff to our area at a time when cases of the coronavirus, particularly in Orange County, have risen significantly?
We have to balance out, I think, the environment that they're going to be playing in. It's an isolated environment. And both leagues are going through great lengths to ensure the safety of their players. And if the leagues and the players and the staff believe that they can do it safely in consultation with the healthcare experts, then I say, why not try it? You know, I think America is starving for the televised sporting competitions, and so it's a way for us to get beyond the COVID-19 fatigue that we're experiencing. This is an emotional, I think, mental health concern for all of America. So here we have an opportunity to try to speak to all of those things. So at some point, if it appears that it's too risky for the players and the staff, then I am confident that the league will make the appropriate decision and not go forward.
This next question comes from Scott Maxwell with the Orlando Sentinel. Mayor, last week, you said you're going to look into the $276,000 worth of bonuses handed out at Visit Orlando. I was wondering if you had done so yet, and if so, had any thoughts?
We're in the process of trying to understand what happened at Visit Orlando. I've been a little busy, with some running the county and have full budget meetings today, so I just haven't had the opportunity to delve into the details of that. So we'll continue to review that.
And this last one is from Ryan Lynch with Orlando Business Journal. Let's see. For Mayor Demings, what other budget impacts do you expect the county to deal with as it weathers this pandemic?
I started out today by telling you that I think one of the casualties of the pandemic will be, at the very least, be a delay in the expansion or new construction associated with our convention center. The convention center, with the cancellation of numerous shows, are going to have to come up with some contingency plans to reduce their overall expenses associated with operating the convention center. So that'll come forward. We will see the same happen with other county departments. We will not be expanding our budget this year. The budget will remain flat, if not be slightly reduced, going into the new fiscal year. So that's another casualty of the pandemic itself. But we're not unique here. Every metropolitan community around the globe is experiencing this global pandemic. And so we're all struggling together. I think the localities that will come out of it faster will be the ones that are better prepared to hit the ground running. So while we are living in the misery at this point, my job is to help us prepare to hit the ground running as soon as we possibly can. And we're going to continue to do that.
Text back in for you, Dr. Pino. He wanted some examples of maybe what antibody testing could look like here in the county, or what you might be able to divulge to him now of those plans.
So we are in the search for the equipment and be able to acquire the equipment that is needed for some either antigen testing or antibody testing. Antibody testing has been done right now in different locations in the county. What we are looking is for the Department of Health to acquire that capacity as well. But it's not something that we are pursuing aggressively, because we are more interested in controlling outbreaks right now than determining if people have immunity to the disease.
Okay. If there are no other questions, thank you all for joining us today, and we'll talk to you in a couple of days. All right. Stay safe.